Hi, good day. Today I will be discussing about pyonephrosis, which is a serious and potentially life-threatening condition characterized by suppurative infection of the kidney associated with obstruction of the urinary tract. We will review its pathogenesis, clinical presentation, diagnostic modalities, and management options. And I am your instructor, Dr. Junaid Bajwa, presenting you this lecture in quite comfortable way. Pyonephrosis is distinct from a simple infected hydronephrosis because it involves pus formation within the collecting system due to bacterial infection. The obstruction prevents drainage, causing progressive renal destruction and potential sepsis. The primary cause of pyonephrosis is obstruction. Stones are the leading culprit, followed by malignancies or congenital narrowing of the urinary tract. Infection supervenes due to bacterial colonization, commonly caused by gram-negative bacilli. Comorbid conditions like diabetes exacerbate the risk. As you can see, other predisposing factors causing the pyonephrosis include diabetes mellitus, immunosuppression, and indwelling catheters or stents. Pathophysiology includes the sequence begins with the obstruction leading to stasis, which fosters bacterial growth. Pus accumulation increases intrapelvic pressure, compressing renal parenchyma, leading to ischemia and functional loss. If untreated, it can rupture and causing perinephric spread or systemic sepsis. Clinically, patient presents with classical features of urinary tract infection and obstructions like severe flank pain, high-grade fever with rigors, and sometimes a palpable renal mass. In advanced stages, septicemia and hypotension may ensue. Laboratory investigations typically reveal signs of infection and renal dysfunction. Pyuria and bacteriuria confirms the infection, while culture identifies the causative organism. Elevated creatinine indicates impaired renal function due to obstruction. Imaging studies includes first diagnostic tool is the ultrasound, which can visualize echogenic debris indicating pus. Then CT scan of the kidney, ureter, and bladder provides a detailed view of the collecting system, identifies the level of obstruction, and is essential for surgical planning. The main differential is hydronephrosis, which lacks infection and pus. CT imaging and clinical findings helps to distinguish these. Chronic infections may mimic xanthogranulomatous pyelonephritis. Management begins with urgent decompression of the kidney, usually by percutaneous nephrostomy or ureteric stenting to drain the pus and relieve obstruction. Broad spectrum antibiotics are started empirically, tailored later by culture results. In cases of non-viable kidneys, nephrectomy may be required. Prognosis largely depends on timely intervention. With early drainage and antibiotics, recovery is good. However, delayed diagnosis can result in irreversible renal damage or septic death. So, to summarize, pyonephrosis is a urological emergency that represents infection in the presence of obstruction. Quick recognition and decompression are essential to prevent irreversible damage or mortality. So, early intervention is the key to preserve the renal function, and it is an emergency for which we should need to drain the kidney quite early. So that's it for today's lecture. Hope to see you in next upcoming lectures. Until that time, take care and goodbye to all of you. Thank you.